Hey everybody, thanks so much for joining us today. Really excited about this webinar. So for those of you who don't know, my name is George McLaughlin from Redox. Redox is an integration platform helping digital technologies get in the hands of patients and providers. And really excited to kick off a new series today called Health Tech Heroes. Why we do what we do, which is provide a way for our partners to read, write, and query clinical data with all of their health system customers, electronic health records, and other software systems, is because our partners are making amazing solutions which are changing the way that providers provide care and patients receive care. And for all the work that we do in integration and back-end stuff, what's really most exciting is the patient provider-facing solutions that our customers are offering. So today I'm joined by Kim LaFontana from Docent Health. Docent Health is doing really incredible things in the patient engagement and care coordination space. So we're going to have her overview their product and offering, and give you a really good example of how digital health is changing the way patients receive care today. So Kim, take it away.
Awesome. Thank you so much. Thanks, Redox. We're Docent's thrilled to have a chance to partner with you guys in general and on this webinar today. So thanks for that nice intro. So I'm Kim LaFontana. I'm with Docent Health, and we're based here in Boston's Back Bay. And just by way of background, Docent Health is a group of people who believe there's a huge gap in even the highest quality clinical care that gets delivered today. I'd ask you to maybe consider for a moment, as a patient or a caregiver, those moments where you may have felt that care was impersonal or cold or generic. And did that ultimately impact how it went and what the outcomes were? We here at Docent believe it does. And we believe that, bringing some humanity back into healthcare is the solution. And so that's what we're all about. And humanity isn't just in the touchy-feely sense, although we love that stuff too. We believe in sort of deeply understanding each patient's needs and addressing those to help them have better outcomes. To do that, we use really advanced data science, technology, and analytics to connect with patients, and as I said, sort of bring humanity back into the way healthcare gets delivered. So just to explain a little bit about where we see the industry today, the problem that we see is that despite knowing more about patients than we ever have in terms of digitally available information that is stored and collected in the electronic medical record, there's some things that are just missing in care delivery today. So we know a ton about patients across all these metrics on this page, but when you really think about what matters to a patient outside of these clinically measurable facts, these are obviously hugely important. And we believe that the healthcare system is failing ultimately to get to know patients as unique individuals. And what's worse, failing to uncover the factors that would make a difference to them in their care. So does a patient have the right home support? How do they feel about taking medication? Are they likely to ask questions or not as they engage in making care decisions? Those are, we would argue, as important as some of the factors we saw on the previous page. You could also almost think of this as a different flavor of precision medicine, right? So it's not genomic information, but it's behavioral and psychographic and social support factors that we believe are the flip side of what's important to know about a patient to figure out how to take the best care of them.
And one thing that's really important also to add to that, and from our position, is that obviously we're moving to this value-based care from a fee-for-service model, and these healthcare organizations are now tasked to ensure that patients actually get better. But without tools like Docent, they don't have that type of transparency into those factors. I mean, that lack of home support, for instance, you can provide the best care and give the best instructions, but if you're not able to be in contact with that patient, or if you aren't aware that they're not, they didn't fully understand your instructions or don't know how to follow it, then it taxes everyone within the system. So it's another example of, we mandate that health systems have to now follow these rules, but we don't always provide them with the tools or the resources to actually do that effectively. So that's where groups pop in, and that's one thing that's awesome. Docent's making it possible for organizations to actually deliver on these new metrics for success.
I think that's really well said. And, I think there is a growing recognition that this information matters, right? And, what I tried to capture here is there's a movement that most people refer to as patient experience. And it's on a lot of different constituents' agendas to try to understand this patient experience. So patients, are increasingly looking to social media and to peers. How did it go? What was it like to get care there? Patients are not likely to go to hospitalcompare.gov. They're more likely to go to Yelp because they're looking for information on whether or not that healthcare system knew them, took care of patients as individuals, and provided that kind of personal connection. As payers and employers think about what they want to pay for and who they want to contract with, HCAHPS is one factor, but there are many others that they're looking to measure value add on. And then providers themselves, if you're a healthcare system or a hospital today, the traditional competitors out there are investing in experience, and you have a whole emerging class of competitors in the form of retail clinics and concierge primary care offices that are providing an entirely different experience for patients. So there's a lot happening. I think, though, the bottom line is that we don't see this coming together in a truly orchestrated and connected way to actually understand patients and connect that up into their care in a real way. The research tells us that what's happening there is just not enough. Patients still feel really disconnected, and the efforts to tackle this are really kind of too small in a way. And let's take a minute to think about what's really at stake for a health system. Beyond the obvious that it's the right thing to do to get to know your patients and take care of them as individuals, there's real economic value that can be created or lost based on the kinds of relationships and the depth of relationships you're able to build with your patients. So, both near-term and long-term value is at play here. If you think about customer satisfaction and retention today, health systems have an opportunity to convert that into lifetime personal and family loyalty. Most health systems get on average something like 40% of an individual patient's spend, even a loyal patient. And in other industries, that just wouldn't be great. So let's try to think about that and take that on. Acquiring new patients is on every health system and hospital's executive's mind today. How can you transform that in the long run to be a destination brand in your community and compete against some of those newly emerging entities? Most boards would have a strategic goal that sounds something like this, but we don't see a lot of efforts in place to truly, kind of take that on. And then, consumer promotion, a more sophisticated longer term way to think about that is creating an influencer strategy. Who is it that's out in the community that's talking about your health system? These really get at what people refer to as the triple aim, right? Which is, creating great experience and relationships with patients, not only help that patient experience be better, but these are growth and quality objectives as well. And in fact, here are some of the stats that we at Docent have been able to create at the clients where we're active today, but driving things like increased selection of in-network physicians, keeping those patients in your network, shifting referral patterns. So when primary care physicians or referring physicians know that Docent is present, and I'll tell you a little bit more about what we do in a minute, but just know that, offering a superior experience can result in a shift in referral patterns, and we've been able to see and demonstrate that. Measuring and capturing net promoter score and testimonials is a piece of this as well. So really deeply understanding what your patients think and then marketing based on what you hear from your patients is sort of a new idea in healthcare, but one we think the industry is really ready for. On the kind of longer term side, we've been very enthused about some of the results we've seen in clinical metrics around education, for example. We haven't been live for a year yet, and we've already seen 11% increase in the adoption of the educational resources available to patients that we serve. So we figure out why a patient hasn't gone or taken advantage of education that's offered to them, how to knock those barriers down, and how to get them to do it. So winning that patient over to take the action that we think is the right action for them based on their situation. And then we screen patients for clinical risk as well. So those are just a few examples of the kind of value we're able to create. You know, to do this, we have taken on this challenge in an entirely new way. So we think of it as kind of an outside-in approach that we've adopted. The question we asked is, you know, what do some legendary brands outside of healthcare do today to create loyalty and relationships and the ability to win over and influence their customers? So these are a few of the brands we looked at and studied. We love this quote from Disney. You know, Disney loves the fact that when guests come to their parks, they refer to it as a magical experience. The Disney executives that we spoke with are super clear, though, that, you know, there's no magic behind the scenes to make that happen. This is hard work, and it's a deliberate process that they've invested in both technology, data, and people to make that happen. So there's a really concerted effort to create magic. And that's really what we're all about in healthcare. When we kind of took that apart, you know, it turns out that there's a finite set of vectors that matter to create that kind of consumer experience. We've identified these 9 that matter. And it's important to note that these don't all matter to everyone. So every patient is different. And the trick is to align experience and service to patient need. So take, for example, a new mom versus an experienced mom. Even if they're clinically similar and have similar demographics, just obviously based on the fact that one's had a baby before and one hasn't, they're going to have different questions and different needs. They're going to want to optimize different things on the spectrum. So knowing who an individual patient is and what their needs are, and then delivering against that is the magic we're seeking to create.
And this is a really cool thing, because I think a lot of people, when they think about technology in healthcare and this move to, you know, customized care, you think about it at, you know, a genomic level, and maybe if you have these markers, you should take this prescription instead of this one, and so on and so forth. And while that is relevant and viable and an exciting aspect of, you know, more technology-enabled healthcare, these, you know, these personal characteristics, personalizing at this level is equally important and actually more actionable today. So I think this is a really good example where sometimes when you think about the future of healthcare, you get really kind of far off into the sort of borderline science fiction stuff, and you get excited about it, when the reality is there's so much more we can do to customize and cater the entire patient experience just by being smarter, more thoughtful, having tools that associate all these things. So I think it's really awesome.
Yeah, that's a great transition to, you know, I wanted to get into a little bit about what we do and how we deliver on that promise. We marry human interactions with great technology. So we believe that the technology is a critical component here to generate those insights and to know at a patient level what their needs are, and then to deliver those in a modern digital way. But we also believe in the human connection. And so we have docents who talk to patients on the phone, over email, over text, and in person. The docents are hospitality-oriented and trained individuals who you would love to interact with. They're fabulous people. They're great listeners. They're empathetic. And patients just have an extraordinarily positive reaction to interacting with the docent. You know, we really think of this as like the next evolution of digital health, using technology to define specific beneficial steps for a patient, but then doing it in a way that feels real and is real and feels meaningful to the patient. So that's just kind of a quick little overview, and I'll show you a couple of our a little mini demo here in a second. I wanted to just touch on something in our, you know, sort of core in our DNA. We think of the premise of what we do as almost like the golden rule. You know, we uncover and solve real problems for patients, and that earns us the right to have a trusted and loyal relationship on behalf of the health system, and earns us the right to influence their choices. So we think of this as reciprocal value. This isn't a nurse calling to tell you what to do the night before your surgery. This is a docent calling to say, hey, I know you have surgery coming up in a couple weeks. How are you feeling about that? How can we help you be ready for that? And patients respond in an incredibly positive way. Just to show you a little bit about the tech platform and how we deliver what we think of as kind of humanity at scale. This is, a list of patients that would be coming in for procedures. This happens to be an example in orthopedics. One patient's having an ACL reconstruction. Some are having other surgical procedures. This would be the list of patients that a docent would want to reach out to. Some of them is initial outreach, and some of it is that we're responding to interactions patients have had with us. On average, if we're able to connect with a patient, we have multiple connections. So the engagement rate is very high, and patients remember that they talked to the docent and the docent was helpful, and then they come back and ask us for more. So we take that as a real sign that we've been successful in creating that bond, and we're happy to help them and solve some of the problems they have that maybe aren't obvious, or maybe they didn't want to ask their physician or their surgeon about. Either because they think it's too low level, or they're embarrassed about it, or it didn't occur to them at the time. Having a place to go to get those questions resolved is a pretty powerful thing. And I think all of us can kind of identify with. The example here is this patient was coming in for an ACL reconstruction, and we reached out and did a phone call with him and talked to him about that. We learned some important facts. We learned that he's a cyclist. We learned that he's really nervous about this procedure, specifically because he's nervous about anesthesia. And he's actually thinking about postponing the surgery. So he shared that with the docent when we reached out to him in what we call a warm welcome call. And we can take some action based on that. We can provide him some information. We could connect him up with the anesthesia group to answer questions or try to resolve some of his anxiety. And we might alert the physician or the hospital that this patient has some no-show risk. Right? So that's a big deal operationally. The surgery is the right thing to do for the patient, and there would be a big cost to the surgeon and the health system if he didn't show up. So, those are some of the kind of important facts that we learn and can act on and help get that patient comfortable so he does come in and get the surgery that he needs. Based on what we learn about him, our technology is configured to create a customized series of outreach. So after that warm welcome call, we may have notified the physician's office. We would also plan to reach out to him a couple more times with some preoperative planning, and then another scheduling reminder, because we knew he was a no-show risk. He's probably going to get an extra touch. It might be on the phone. It might be digitally. We do a lot of texting with patients. The response rate is very high, and it turns out to be a really efficient way to communicate. In fact, I have an example of that coming up in a second. On the preoperative planning call, we're looking to learn information as well as share information with the patient. So some of our interactions are scripted. We'd have a series of questions that we'd be after and trying to answer. We'd also be available to answer any questions the patient has or help them follow up on needs that they have as well. And then the patient likely remembers that we're out there. So if we reached out with a, hey, how are you feeling? Is there anything else you need? And that can be an automated outreach. This is a pretty scalable approach. If he responds and says he's looking forward to this being over, and oh, by the way, I forgot that I have a special diet that I need to get compliance with, that's a real concern that he has. And if you think about that as a patient going in for surgery, who would you ask about that? How would you try to resolve that? That's something that we could help with. And then finally, as I said before, navigating a patient through a clinical journey successfully, getting them to a point where they had their procedure, they're feeling good, their experience was positive. We're after that testimonial at the end. So when we call the patients or contact them digitally after discharge, we not only ask them a net promoter score type question, but we ask them for a testimonial, and that we capture that on behalf of the hospital or the health system, make that available for them to use in their marketing materials. So this is, a patient that is happy with how his outcomes went, not just clinically, but also he felt really heard. And so we'd want to make that information available to the health system that they could use in some of their outreach materials as well.
One thing I wanted to call out is that for everyone watching the webinar, you can also see Docent has very tasteful design, which you'll see even on their homepage and then into their app. For us in healthcare, design there's not a lot of it. There's not a lot of good design and tools that people use or reference. So that's another thing I think that's really exciting about these new tools and solutions. This more Web 2.0 type look and interface, which when you have caregivers interacting with this data can be really helpful and actually help provide better care by being able to to actually take it all in. So kudos to you or whoever's on your design team for working to make some good looking healthcare solutions.
Good. Yeah, we're proud of that. Thanks. You know, I'll just close with, you know, we're partnered with some great health systems today. And we've interacted with tens of thousands of patients. We have a learning platform where all the data that we collect is stored and captured, and we use as raw material to iterate and learn make our service offering better. We have a pretty well documented process for how to pull this off. It's you know, we can be up and running in 6 weeks or less. We do some blueprinting where we understand the gaps you're trying to address. We get the technology live and up and running, and then we're talking to patients sometimes in as little as 3 weeks. In advance of scheduled procedures, getting on the phone with them turns out to be high value, and so we do that as soon as we can to start to build those connections. And so I think that's pretty much it from the docent side. You know, we like to think of what we do as creating experiences that to a patient and to the health system feel beautifully connected. And that's an unusual thing in healthcare. We're pretty proud of that, and think that we're delivering something that's unique, and delivers, you know, not just that nice to have human connection, but delivers the real economic ROI that goes along with that.
Fantastic. Thanks so much, Kim.
Yeah.
And a quick reminder to anybody watching live, make sure to start asking questions, because we will get to those when I complete here. So I want to take a quick moment, you know, talk about where Redox fits into all of this. So, you know, what we do is basically we work to help Docent get as much information as is available within electronic health records and is already available at the patient, that allows them to one, you know, cut down on double documentation. It's a lot easier to enroll a patient if you can be receiving their information from the health system already, past medical histories, things like that. You can complete the beginning of the profile, which is a starting point that then the docent's getting additional information and adding that additional context. So with Redox, it allows docent in a really efficient technical way to receive that information from their health system customers, and to do so also in a way that doesn't change based on the electronic health record in use. So for instance, I know, you know, we're working with Docent already at Epic and Cerner sites. In a traditional setting, they would have to work to, you know, create a customized development logic to handle the different way that those systems are sending them information, which is time that their developers could be used, you know, working on the product itself that is actually being interacted with by the users, and then what you do with that data. So, you know, patient histories, past medical records, which are involved as part of the coordination, information on how to contact them from emails to phone numbers, which is already available in electronic health record, is all information that we help them access through a single centralized platform and API interface, which again frees up their developers to focus on the product, which is actually, you know, used by users, instead of working on this integration component. Finally, you know, it's really important, obviously, for this type of tool to always know, right, when is a new appointment scheduled? When's a test ordered? Is the patient admitted? In Docent's case, they would probably know, but in case maybe a patient's admitted and then they get alerted by that and they can reach out proactively. It's really important to have that in sync communication with their customers so that they can have as full a picture as possible to keep the experience, you know, at the highest level. And, you know, we're so excited to see the tool used to help accelerate the distribution of Docent. You know, what we do is really to solve this one problem in healthcare, this integration component, which is critical, but there's also a lot of other problems to solve. So whenever we can help simplify that so that you guys can, you know, get a solution like Docent in as many, you know, as many sites as possible, as quickly as possible, that's when it can start, you know, impacting patients positively, which is what we're so excited about and why we're so excited to be working with Docent. And if anyone from UW Health is on here, I would like to see Docent there. As a patient, I don't even get text reminders. So let's adopt some technology from my area. So yeah, again, you know, the point of this series is we're going to be highlighting the amazing partners and the work they're doing, and how it's transforming healthcare, and really excited to have introduced you all to Docent today, and excited about your questions. So if you want to reach out, So there's contact information for both organizations here. If you're watching this webinar after the fact and have a question, please send it to this email or tweet us, or on our website. We also have contact forms available there. Kim, do you have any other additional information of how people could reach out to you?
We're just grateful for the chance to tell the story and engage with folks out in the world who are thinking about the things we're thinking about. And we are grateful to Redox for being a great partner. The integration work that you described is super valuable to us. It's the raw material for what we do. And yeah, we'd love to chat with anybody who has more questions. So please feel free to reach out.
Fantastic. So we'll get to the questions now. Thank you so much for everybody for joining us, both live and after the fact. And yeah, if you're a health system or a patient interested in awesome tools, go check out Docent. If you're building a solution that needs to integrate with electronic health records, come check out Redox. We can help you develop, get discovered, and distribute that a lot faster than you could on your own. So thanks again.